So we're looking here at managing soft tissue injuries, and what we've got an athlete that's presented themselves. This is obviously once they've come from the field, it's the end of the activity, or obviously they've stopped the activity because of the severity of the injury. We've got a right ankle injury here, alright, which would be known as a soft tissue injury. There's a little bit of damage around where the ligaments are, so there'd be some swelling, there'd be some bruising, there'd be some discoloration. So the first thing we need to do for this athlete for this type of injury, being soft tissue, is we need to rest. So we're going to go through the RICA regime. The first one being R for rest. So we've asked the person to sit down, be nice and comfortable, just to relax and take a bit of pressure off where the injured side is, so therefore not causing more damage to where the injury is. So that's rest, and that's really important that the athlete's able to do that initially to give himself a very good chance of recovery. While the athlete is resting, we're then going to ice the injured side. So what we're looking here for is to get the ice onto where the injury is. So we'll put that there. Try to be careful to make sure that we don't burn the skin due to the ice. If people have some of the cling wrap, again, I can help, the injured person can help me here, he can help me just hold that on there. So we're just looking to ice. The beauty of the ice is it's going to stop the actual blood from flowing to cause more damage. So there's our icing. So we've put the ice on. What we're trying to do is we're trying to reduce the amount of blood that can get to the injured site. Vasoconstriction, what that does is the ice, because it is cold, it tightens up the blood vessels, therefore allowing less blood to get through to where the injury is, because the first response of the body will be to send more blood to where the injury is. If there's less blood, then we're going to have less swelling, we're going to have less bruising, we're going to have less pain for the athlete, there'll be less discoloration. So these are all the signs and symptoms that we want to try and reduce to aid and speed up this recovery as quick as we can. So that's our icing. Now we're looking to ice for at least 20 minutes on every hour and a bit. As long as we've got some ice on there for at least 20 minutes every hour, then that's going to be fine. It's going to do the job that we've spoke about before. So we've rested the athlete, we've got some ice on the injured site. We're now looking to compress, alright, or a compression band is what we need to do. So I spoke about before for the ice 20 minutes on, then we're looking probably about 40 minutes off. So once I've finished, if this was 20 minutes of ice, I'd take the ice off. And then with the use of a bandage of some sort, this is in between while we're icing, I'm going to put a compression bandage on here. Again, what the compression bandage is going to do, trying to have little movement as I can with this injured leg. Just nice and tight around the ankle. Again, to try and reduce the amount of blood that's actually getting into the injured site, to stop things like swelling and bruising and deformity taking place. So there's the compression bandage there. Okay, so it's put on nice and tight. I need to check with the person that it's not too tight. Okay, I can pinch his toe, and if the colour returns back to his skin, then I know that the bandage isn't too tight. So that's a tight compression bandage there. So we've gone through rest, we've gone through I for ice, we've gone through C for compression, nice and tight again to reduce the amount of blood. We then need to elevate above the level of the heart. So what we need to do here, we can bring over a box, we can use a school bag, we can use a chair. Just supporting the person's injured leg. We're going to move up here, and I'm just going to ask him to elevate his leg there for a minute. He might even just lay down nice and flat. And what you'll notice here is straight away for elevation is that the injured site is above the level of the heart. So therefore the blood's going to be running back down due to gravity. Less blood's getting to the injured site. So when we're not icing, we've got a compression bandage on there. We also need to be elevating. That way it's going to stop the amount of blood that gets there. Again, we're talking about discoloration, deformity, and all those sorts of things. Okay, so that will be our elevation. And again, this would be left on in between our icing. Same with the compression bandage. The last thing we need to do would be R for referral, which we need to then pick up a phone and call a physio or a doctor or a sports trainer and ask them for some advice on what we may need to do. Can we get them looked at from a physiotherapist just to make sure that there isn't too much damage there.